getting closer to finals, so we know people are pretty busy. But thank you so much for meeting with us today.
Yeah,
Um,
of course.
my name's Bella. I'm the president, and then Finn, if you want to introduce yourself.
Hi, I'm Finn. I'm the vice president of the club. It's very nice to meet you.
Nice to meet you.
I know we talked about in our email that we were going to just go over general paths to nursing, and then I think talk about the nursing administration and nursing educator, both of which we haven't talked about in our club yet. So I'm really excited.
Okay, great.
So I guess if you want to start just introducing yourself and all of that.
Okay, sure. Well, hello everybody. My name is Catherine Berger, and I have been a registered nurse for a long time, coming up on 35 years. I cannot believe how fast it's gone. I started off my nursing career with my associate's degree. I got it from a small college in California, Napa, California. So lots of great wine. Although I was young, so I didn't drink it at the time. So I worked with my associate's degree for about 18 years in my career. And I had been doing a lot of different leadership positions. I was working for Kaiser Permanente in the Sacramento area. And I was put in a position where they said, well, when do you finish your master's degree? And I said, well, I still have my associate's degree. And they said, oh my gosh, you need to have, your master's degree for this position. And so I quickly went back to school, which it's not quick, but I went back and got my bachelor's degree in nursing. And then several years later, with 5 kids at home and running the largest ICU for Kaiser, I went back and got my master's degree. So right there, it's proof that number one, having a base as the RN, no matter which avenue you come into nursing, um, will lead you down paths that you may not have known, and that you can always go back to school for other degrees. So, having worked in the field for a long time with an associate's degree, I felt that it was a very good base for nursing. I thought it was an excellent base for nursing. And then as I pursued more educational goals, I did realize that there's a lot to be learned in academia, and having to do it again, I wish I would have started off with my bachelor's degree. That would have kept more doors opening earlier in my career. But it's never too late to go back. So there's a little bit about me. I'm up in Boise, Idaho. We've been up here for 5 years now. We love it. Kids are grown and gone. Well, we have one student at University of Utah, and 3.7 grandbabies. So one more on the way. So there's a little bit about me.
That's awesome. I will say Bella, her audio is acting up a little bit, so I'll probably ask some questions too. But
Okay.
I was gonna ask, what do you know about like accelerated BSN, ABSN, versus DE-MSN versus maybe some other pathways, and like what has been your experience with each of these?
I will say that, and not to shamelessly plug my website, but registerednursing.org um, really answers a lot of those questions. So if you Google any of those questions, oftentimes registerednursing.org will pop up. Um, my experience with those is the accelerated programs are good, but oftentimes they're expensive, they're pricey. So you're going to pay for that quicker degree. Some of the programs you have to find your own clinical experiences. So you really need to know what you're coming up against when you go into those programs. Number one, first and foremost, and I don't care what they tell you, the school has to be accredited. It absolutely has to be accredited. I've had, unfortunately, some friends who have jumped into a program that the school was saying, oh, we're right on the cusp of getting approved for accreditation. and they lost all of their money because you can't sit for the nursing board, the NCLEX RN, unless you've completed a program that's accredited. So first and foremost, accreditation. Number two, you need to be asking, what is my commitment if I'm working? Am I able to work? Because some people can't afford to just completely quit, and they maybe don't want to go on complete student loans while they finish their degree. So asking that at the school. The other thing to ask would be the clinical expectations, and if they find those clinical rotations for you, and if so, are they in your area? Because I've had colleagues who've had to travel to other states to get their clinical time. So those are important questions to ask. It can be a very positive experience to do an accelerated program. It works well for a lot of people, but those are some important questions to ask.
Thank you very much. To follow up on that, what can you talk to us more about your website, and also could you give us some detail on why you created the website? Like, what was your motivation?
Yep. So I actually didn't create it. It was created by a company who actually they own a lot of websites, and they have licensed practical nurse. They have nurseeducator.com. And so what I like about registered nursing, I started writing for them. So that's another career in nursing. And we can go over some of those like weird careers within nursing. But I started writing for them. So I have a writing business on the side, and companies pay me for my nursing opinion, which is pretty cool. Um, and so I started writing for them, and then I became their chief nursing officer. And I'm kind of their community liaison person if somebody has a question about the website. So I've written a ton of articles for their website. And it's been so fascinating because I'll get a question like, well, what does a school nurse do? And pardon my French, it's like, I have no idea. I didn't say the French part. Um, so it's been a really interesting role to be able to dig in to see what these other fields of nursing do. But it is a great website because it has, um, if you're interested in military nursing, what does a prison nurse do? What would it take for me to get my nurse anesthetist? And so it really does we try to answer all of those questions for prospective nursing students and nurses who are returning to school.
That's awesome. And it's funny because we actually just gave a presentation at our club yesterday about nurse anesthesia, so it's funny that you bring that up.
Yeah,
Um,
that's a great job.
yeah, I agree. Um, so we also wanted to get to like the heart of this like Zoom meeting with you. We really wanted like to know more about like nursing administration and nurse educator. Like what roles are there in nurse administration? Because I know there's a lot of students who think, oh, I'm just going to be an RN and do these duties, and like it's kind of like fixed, but there's not much like I guess we haven't had much information in this club yet about like the hierarchy of like what
Okay.
you do within nursing, and like you write for the website. So
Hmm.
if you could just go
Sure.
into some different roles or like responsibilities and like how you'd get there.
Okay, great. So, nursing administration is a lofty goal for a lot of nurses. And so you have so many different levels or roles within nursing, right? So you have your bedside nurse, and your bedside nurse could be bedside in home health or in the hospital or in a outpatient surgery center or in an outpatient medical clinic, outpatient community health clinic. So your bedside or your patient facing nurse is closest to the patient, essentially. And then as you go up the food chain, essentially, so then you have a charge nurse, maybe, and a charge nurse is typically involved in the daily operations. So they're kind of the informal leader. They don't typically have a title of executive or administrator because they're in charge of making sure everything runs smoothly. And then from there, you'll have a nurse supervisor. And a supervisor typically has frontline staff that they're responsible to make sure that they're competent and do their evaluations and check in with the patients and make sure everybody's happy. And then from supervisor, you might have manager or assistant manager. Every different organization and facility has their own terms for these same levels of leadership. Um, and then from a manager, you might have a director, and a director is going to be in charge of numerous, or sometimes just one if it's a larger area. Um, and that director is usually setting the budget for the department and managing the strategic plans of that department. And then your director is going to report to like the chief nursing officer or chief nursing executive, CNO, CNE. And again, depending on what facility you're at, there may be two of those, there may be numerous ones of those at that level. And then from the chief nursing officer, you'll have along that same level, there's a lot of different roles. Like a girlfriend of mine works for, she's the chief nurse of innovation. It's like, what do you even do? You know, and she gets to like do all the cool, innovative stuff. Let's pull this AI stuff in and let's create an app for that. And, you know, and let's make this more efficient here. So that's very cool. And then from there, you'll have like the president of the organization or the chief medical officer, that type of thing. So there's varying degrees of levels of nursing administration depending on the organization you're in. And you may have 50 people reporting to you, you may have 5 people reporting to you. It varies greatly from organization to organization. Does that make it clear as mud a little bit?
Yeah, that was great. Yeah, wow. I mean, personally, I don't know about you guys, but I didn't know there were just so many levels of organization. That's it's really interesting to hear.
And I will add also that, and I was one of these nurses for a while working at the bedside. It's like, oh, I'm never going to leave the bedside because I became a nurse to work with patients and I love that piece of it. You know, and just out of nursing school, I did labor and delivery and I hated it. I hated it because I'm an ICU personality. And so I wanted to know like how much my patient peed in the last 15 minutes. I wanted all the nitty-gritty details. And in like labor and delivery and emergency room, trauma, those type of environments are very fast paced and like treat them and street them type of attitude. And so you tend to pick your nursing specialty based on your personality. I'm a planner, like to know everything. Nurses tend to be a little bit territorial. So these are my 2 patients for the day, that type of thing. Um, but you know, I also out of nursing school. So after labor and delivery, I went into ICU and did that and loved it. Um, but what I found is that I really felt like I could make a difference for not just my patients, but the entire organization. And so that's what kept pulling me into leadership was that if you feel, and I almost tell people that it's a personality flaw, if you feel constantly that, yeah, this is good, but what if, and you're always asking, but what if we tried this? And what if we tried that? Then you probably would do well in leadership because it's not just about making things better for the patient, your 2 patients that you have for that day in ICU. It's about what can we do globally for healthcare, for the organization, and for our colleagues. So I felt a strong calling to help my colleagues and improve the working conditions for them because I knew what I didn't like in leadership and I knew what I liked and I felt like I could make that difference. So it's not all about the bedside or all about leadership because you can always pop back and forth.
Thank you. Yeah, no, that's really admirable. I like kind of like even though there's kind of like territorialness within nursing, there's also like this desire to make everyone's job
Hmm.
easier too. I think that's really
Yeah.
cool.
Yeah.
So we also wanted to ask like you mentioned earlier, like weird careers, like prison nurses or like, I've heard of like oil rig nurses and like just, weird niche stuff like that. Like, do you have any like niche nursing roles that like many people like don't consider, but if they knew about it would be like very open to it?
Yes. So I think right now the latest phrase that I hear from so many nursing students is I want to go into aesthetics. I want to go into like injectable Botox and fillers and all that kind of stuff. And and that's a great role. Um, and it depending on the state you live in, your scope of practice may change a little bit within your state. Um, so aesthetics nursing is a good role. It is I wouldn't say it's boring, but it could be boring because it's going to be, people coming in on an appointment and maybe your day isn't filled. So if you're paid per patient you see or client you see, which is most often, then you might struggle with paying your bills a little bit if you're not in like a big like clinic or not clinic, but an aesthetic day spa type thing. Um, so aesthetics nursing is something that's interesting. I actually had a girlfriend in college who was an art major, and she and I were roommates. And I finished nursing and I was out and working and making all this money. And she was still like doing art. And she's like, wait a minute. And so she switched and went to nursing and got her nursing degree. And she's an aesthetics nurse, but she's also, because she has that eye for art, she can look at people's faces and like the symmetry and everything. So, so that's really a passion of hers. But it also helps that her husband owns a surgical plastic surgery center. So, so that helps. So aesthetics nursing is like the craze right now. Um, I do recommend it's not completely necessary, but I do recommend to get a good couple years of basic nursing in like a hospital setting before you go into these specialties. Again, it's not required, but you learn so much those first couple years of nursing with time management, working in stressful environments with your colleagues, prioritizing your patient care, that type of thing. That those couple years of basic nursing are invaluable. Now, whether that's in, the OR setting or med surge or ICU or labor and delivery, it doesn't matter. But going into some of these other nichey things afterwards, after having that base is really valuable. So some other areas like you talked about on an oil rig. So you have occupational health nursing. And that's a really interesting field because especially like through COVID, we had occupational nurses. I was actually acting as an occupational nurse for our company where you're screening people for symptoms of an infectious disease. You're screening people for you're training them on prevention of injuries. You're working with your organization to make sure that they're preventing injuries like slips and falls and things like that, and working with safety committees. Another interesting role for nurses is infection control. So again, through COVID, this was a huge one, and many long-term care facilities were cited because they did not have infection control nurses. The infection control nurses, they do everything from being in the hospital and you're tracking infections, you're working with the infectious disease clinician, you're tracking hospital acquired infections, you're looking at rates of antibiotic use in your facility. In addition to if you're going to have construction in the facility, the infection control nurse would go out and make sure that everything's clean enough and you're not putting patients or staff at risk. So infection control is another kind of one of those weird ones that's really interesting. Again, innovation, right? You have innovation. Um, and then another interesting one is cannabis nursing. So there's nurses who work with patients to, if patients are going to use cannabis as a medicinal properties or maybe just recreational, how is that cannabis interacting with all the other medications they're on? And so there's nurses who provide education not just to patients but to clinicians on how to manage those medications, that it's therapeutic for the patient. And then it's also getting into all the other mushrooms and all of those other, therapeutic doses of alternative medicines that are out there. So that's been really interesting. Nurses, we work, in a hospital setting, we work anywhere from, labor and delivery to geriatrics, right? Palliative care is another area. So when people are nearing their end of life, or if they have a diagnosis that might not be might not have a long prognosis, the palliative care nurses will go in and work with the patient and the family and educating them. So those are some of the kind of odd. There's nurses, occupational health nurses on TV shows in Hollywood and New York. So there's lots of different ways. Right now, I currently have a business that I'm a legal nurse consultant. So I review medical records for people who've been in accidents, and I help interpret that medical record and kind of tell the story to the lawyer or the claims examiner to say, okay, yes, this incident happened. All of these injuries are not related to the accident. These are all chronic. Or these injuries are all related to the accident based on this, this, and this. And so within the legal world, there's also areas where if you're an expert, so maybe you've worked in ICU or the emergency room or occupational health or all these other places, you can testify as an expert in court to say, I reviewed this. This is my opinion on what happened here. Legal nurse consultants also go with patients to some of their examinations to kind of advocate for them and be a support person to record the visit. So lots of different areas in legal nursing. What are some other weird ones? I'm sure I'll come up with others after we get off the call. But we're ubiquitous. We're everywhere. Nurses are everywhere. And having that basic degree of nursing and then a curiosity for something new, something different, it's endless. The possibilities are endless.
Yeah, that's always something like I've always been really interested in that too. And we've talked about it briefly in the club, but we haven't really delved into like some of the more like niche positions. So from what I understand, what you're saying is like occupational nursing, like how it differs from just like being an RN. It's just that you kind of like just specialize in like some
Yes.
specific profession or area or like kind of responsibility. So in a way, like kind of like, would you say like nurses are kind of like stem cells in that way? Like you kind of just specialize them towards anything?
Yes, absolutely. That's a good way to put it. And I always say that nurses are the ultimate disruptors. We like to go in and we see something that's going on, and if it's not how it should be, like even with our patients, if you come in and you have a patient with heart failure and you go over with them and they're eating all this processed food and all this sodium and all this stuff, and you're going to try and disrupt their life to make improvements for the better. So, we're the ultimate disruptors, whether we're in a hospital setting or clinic or outpatient. So,
And one question that Bella had was, do you need any like additional like training? Like for example, for nurse practitioner and nurse anesthesia, you have to go get your doctorate. Um, for these like different like levels of nursing, like do you need like are there like different training programs that you would need for that, or can you just go to the job, say, "Hey, I'm an RN, I have an RN degree. Can you just train me on the job to do this specific thing?"
It really depends on the company and the job. There's some roles that you need a master's degree to go into some of those roles. And then once you're in that role, oftentimes there's a certification through the American Nurses AANC, American Academy of Nursing Credential. And so you can get certification of being a legal nurse consultant or an occupational health nurse. And so oftentimes companies are looking for somebody with experience. However, I would say that getting creative, not lying, but getting creative with your resume or your CV when you go to these companies, trying to get an in, um, that they sometimes are willing to take on inexperienced nurses because having that basic RN will gives you the street cred to start with. So some companies are willing to train. It depends on how not desperate, but how interested they are in filling that position. And then the expectation would be that within so many months or a year that you would obtain your certification. There's some certifications that you cannot sit for the exam until you've been in that role for so many hours. There's so much time. Um, so it just really depends on that area. So let's say um, nurse anesthetist or not nurse anesthetist, nurse aesthetics nurses. There's courses you can take that teach you how to do the Botox and the fillers and all that kind of stuff. And then most companies or spas are willing to hire you based on having a certificate. There's no national certificate for that yet. But as long as you've had some formal type of training, they're willing to hire you into that. So it really depends on the area. But you're correct. Advanced practice nurses, nurse practitioners, CRNAs. There's also another role in nursing called clinical nurse specialist. Have you guys talked about that yet? CNS.
I don't think so, no.
Okay, that is a really interesting role. So you have your RN and they provide direct patient care and maybe leadership, all this kind of stuff. You have your advanced practice nurses, your nurse practitioners, your doctorate of nursing practice. Well, your CNS is kind of in the middle of the RN. They're advanced practice, so they've sat for an exam, but they're specialists in their area. So let's say you're a clinical nurse specialist in ICU. You're bridging the gap between the staff and the patients and the clinicians. So they do a lot of education with the patient. They provide valid resources. My dogs are going to bark. Sorry. um, but I would suggest at some point having a CNS on your in your club to talk about what they do because it's fascinating. You can literally go anywhere in the world with your CNS because it's a kind of a more rare animal nowadays. But they do a lot of publishing in nursing journals and things like that. But it's a fascinating role.
Thank you. Also, another question I had was, I've been to advisors at UCSB before, and they've said like I've asked like, should I get my BSN after I graduate from here, or should I get my like MSN or like my ELMSN?
Mhm.
And some of them have said that like the only reason you would like need to choose an EL MSN over a BSN is just if you want to go into like nurse administration and like that kind of thing, like leadership responsibilities. Would you agree with that? And if so, or if not, could you elaborate on why?
Mhm. So I don't necessarily agree. So when you have an RN, and whether it's an associate's degree or a BSN, and then you have an additional bachelor's degree in something else, um, from a leadership standpoint, it usually doesn't matter. There's some some organizations have that requirement that a leader has to have a BSN and then an MSN, but most of them nowadays are saying a bachelor's degree in a related field. So, for example, I've had numerous colleagues with a bachelor's in, um, science of some sort, and then went back to school and got a 2-year nursing degree, and they've been able to do pretty much whatever they want. Now, that being said, if you want to go on and get your master's in nursing, then you have to have the BSN. So there are bridging programs that you can take that will, as you're taking your MSN, you can take concurrent classes that give you the credits for technically the BSN. So there's ways to get around that. And the reason to have the MSN, so when I went back for my master's degree, I got my master's in organizational leadership with a focus in strategic change management. And I really wanted my master's in something that I was interested in. But where that has done me a little bit dirty now is that if I want to go teach if I want to teach nursing curriculum in a nursing school, you have to have a master's in nursing. So I can teach other courses. I can teach leadership. I can teach organizational leadership, all that kind of stuff. So that's the only drawback. And there's accrediting agencies like the Joint Commission and the American Nurse Association. Well, they're not accrediting, but there's other organizations who state that in order to be at this level of a position, you have to have this particular degree. And I want to say like a chief nursing officer is one of those. And it's usually in facilities where they have magnet status, which is a accrediting body for like quality and patient satisfaction, that type of thing. So I would say that depending on what you want to do with your nursing career, you could go and get the associate degree and work in that. And then later on, if you found that you needed a different track for your education, you could go back and get that track. But oftentimes it's just having the RN license alone will keep doors opening for you.
That's awesome. Thank you. Do you happen to interact with many like you say you can teach other courses? Do you teach other courses and have you taught other courses related to nursing then?
I have not taught in a formal school setting. I was an educator several times in my career within the organizations that I worked in, but I have not taught at the college level yet.
That's interesting because as students at UCSB, like there's no nursing degree here, and so most of us plan to do like an ABSN or maybe even an MSN or go the associate's degree route first. Um, so I was just gonna ask you like what does a traditional nursing bachelor's look like? Because for most of us, we're not taking a traditional path. Um,
Yeah.
and while it may not be like applicable knowledge to most of us, I think it's still useful to know since we'll be going into the field.
Well, what type of bachelor's degree are most of you getting then?
Most of us are getting it's with nursing, it's kind of a mixed bag. Like most of the pre-med people at UCSB are like general biology or just biopsychology. For us,
Okay.
mix of like, biology, biopsychology, psychology, there's some like sociology and humanities majors,
Yeah.
environmental studies majors. Like there's just a ton of it's just a really mixed bag.
Okay. Yeah. So a traditional bachelor's degree is all of those things essentially, your anatomy, physiology, chemistry. You have human development. So typically they have those broken up into two sections. So childhood to adult and then adult to gerontology, so human development, psychology, sociology, and then you have to do your other BS classes, right, for the BSN. And then your nursing core classes are going to be similar to that of an associate's degree, where it's all of your different functional roles of nursing. So you would have classes in med surg, which it's very medical surgical is the heaviest. They actually have said, I'm sure you've heard this, but the bachelor's degree in nursing is the hardest degree ever recorded because you have to learn so many different things, not just a couple different areas. Like if you're going into engineering, it's pretty specific. So within your nursing core classes, you have medical surgical, and then you have typically an OR rotation. You'll have pediatrics, you'll have pediatrics, labor and delivery. Emergency services is typically rolled into your ICU rotation. And then depending on which school you're going to, they'll do rotations in psych, which, hopefully you get the experience of going into like an inpatient psych ward that gives you the best exposure to what psych nursing is. And then with your bachelor's degree, different than the associate's degree, you'll have leadership courses. So how to lead a team, that type of thing. So what's good about the associate's degree is they really focus on the task of nursing because they're focused on that the essentials of providing care. In the bachelor's program, they have to also focus on the leadership aspect. So the day-to-day task of nursing is a little bit watered down, in my opinion. When I used to precept nurses in the hospital for nursing students, the associate nurses by the end of their first year, they were taking a full load of patients. And the bachelor students, by the end of their fourth year, were still not taking a full load of patients. So I feel bad in that sense because I worry that the nurses who don't get a good, strong clinical background during nursing school, that they might not get the full appreciation of what the job is. And, right now we have a really, really high attrition rate of new nurses that leave the profession within the first 2 years. It's close to 50% in some studies. So it's important that as you dig into nursing that either you hang in there because it can change, you can change your focus, or you go into it with eyes wide open that it's a job of service. It really is, no matter where you are.
Yeah, I think a lot of us just like I think there's generally like kind of that not stereotype, but that like general knowledge that nurses are like, so revered and like thanked because it's such a difficult, sometimes like grueling job. I think a lot of us like are kind of like trying to mentally prepare ourselves for when the day comes that we, like not some not so good shifts compared to better shifts.
Yeah.
Um, but with that in mind, I'm gonna like probably with our last question here, just ask what exactly would you tell like someone who is about to go into nursing? And um after you answer that, if you could answer, what would you have told yourself before going into nursing? Like what advice would you have?
Okay, those are good questions or good comments. I would say the advice I have is uh, put your head down and go to work. It's hard. Nursing school is hard. Nursing as a profession is hard. We all of us nurses have those stories that we'll never forget. But it's well worth it because it is, I mean, through COVID, nothing was recession proof. There were nurses who lost their job because outpatient services closed down. But in general, nursing is recession proof. You can go literally anywhere in the world and get a job. I've had friends who went over and opened the Cleveland Clinic in Abu Dhabi. So you can travel with nursing all over the world. You can go into the military as an officer and and be on flight crews and ships and all that kind of stuff. Um, so it really is, in my opinion, such a great field to go into because it's so diverse. You can be working from home reviewing cases, or you can be, in the thick of it on top of somebody doing chest compressions as they're running through a trauma center, and everything in between. Um, so it really does fit the bill for so many different personalities. And that's the key is to find your niche during nursing school of what interests you. Um, and I think what I would tell myself when I at that age is just to stay curious. Don't lock yourself into, oh, I'm going to be an ICU nurse and this is what I'm always going to do. Because there's so many opportunities that come. Stay curious. We are the most respected profession out there. The only year we did not get that was during 9/11, and the firefighters took it from us, but that was deserved. But nursing is the most respected, and it's interesting because when you are in the community and you tell somebody, "Well, I'm a nurse," they're like, "Oh," I mean, they give you this look that's very, very distinct, like, "Oh, you're so nice, you're so wonderful," And, um, but the role itself is very challenging. We as a profession need to keep raising the bar for ourselves. Um, you know, I actually was associated, I was on an advisory board for a company that they would put out all these memes that were just really crass and rude about nursing. And yeah, it's funny, but at the same time, you don't see doctors doing that. You don't see physical therapists doing that. And so as an organization or as a profession, we really need to keep raising the bar on our level of professionalism and not just expect a seat at the table, but take a seat at the table because in many organizations, the decisions made for the nursing team are not being made by nurses. So a lot still, we have a long way to go, but it's slow and we're getting there. And we're a mainly female. We're still very, very, female led. I believe we're only up to 11% of male student or male nurses. Um, I could go on and on about that, but it's we need to continue to lift each other up as nurses and as people and not get down in the dumps and not drag each other down because you'll probably hear at some point nurses eat their young. And, and some nurses were raised as young nurses that it's trial by fire and you just have to be pushed in. I mean, literally for me it was I was there 2 weeks and then I was the charge nurse. And, that's how we've done it in the past. And we need to get away from that as a profession. We need to continue to build one another up and continue to make this um, as professional as our colleagues.
Yeah, that's amazing. That's definitely, I think there's a lot of room for like in terms of nursing leadership is maybe like having like I don't know, like a role for like for like inclusivity and kind of like building each other up and like
Yep.
yeah, I think there's a lot to be said about like like the room for there to be more supportiveness in
Yeah,
nursing, not just
absolutely.
for each other and but for, everyone in the profession ourselves.
Mhm.
Also happy to champion that 11%. So
Right.
yeah.
You go, Finn.
Thank you. Thank you. Well, I just want to say thank you. I don't know if anyone else in the Zoom has any questions. I'll just take like 5 seconds if you guys want to type something or raise your hand or unmute. Okay. Well, thank you very much, Catherine, for talking
You're
to us today.
welcome.
Yeah.
Yeah. One more
Bella.
plug for registerednursing.org.
Mhm.
It really is a plethora of information for you. So go in there and just dig around, and anything you want to know about nursing is on there. If you ever want to reach out to me on LinkedIn, if you have any other questions, Catherine Berger, like Burger King. So,
That's cool.
I'm happy to answer any more questions, or if you have questions on the website or ideas on the website that you'd like to see posted, just let me know.
That's great. Yeah, thank you very much.
Yeah, thank you so, so much. I'm sorry I didn't get to ask questions. I'm in a coffee shop right now and I think you can hear everything that's going on. But again, we really, really appreciate it. Thank you so much for taking the time to speak with us
Absolutely.
today.
Yeah.
You.
Good luck to all of you. And I'm so excited that you are choosing nursing, because it really is, it's a calling, it's a job, but it's a calling.
Thank you.
Yes.
I hope you have
Yeah,
a
thank you.
wonderful day. Yeah.
All right.
Bye.
Thanks,
Thank
everybody.
you.